Good day everyone. It is nice to see you again. Welcome to our Any Learning, as our learning community. Lesson 3. Multiple Organ Dysfunction Syndrome, or MODS. Multiple organ dysfunction syndrome is the failure of two or more organ systems in an acutely ill patient such that homeostasis cannot be maintained without intervention. Multiple organ dysfunction syndrome results from systemic inflammatory response syndrome. These two syndromes represent the ends of a continuum. Multiple organ dysfunction syndrome is altered organ function in acutely ill patients that requires medical intervention to support continued organ function. It is another phase in the progression of shock states. The actual incidence of multiple organ dysfunction syndrome is difficult to determine because it develops with acute illnesses that compromise tissue perfusion. Dysfunction of one organ system is associated with 20% mortality, and if more than 4 organs fail, the mortality may reach 70%. Pathophysiology. Multiple organ dysfunction syndrome may be a complication of any form of shock caused by inadequate tissue perfusion. The precise mechanism by which multiple organ dysfunction syndrome occurs remains unknown. However, multiple organ dysfunction syndrome frequently occurs toward the end of the continuum of septic shock when tissue perfusion cannot be effectively restored. However, a pattern of progressive organ dysfunction and failure typically occurs. Organ failure usually begins in the lungs, and cardiovascular instability as well as failure of the hepatic, GI, renal, immunologic, and central nervous systems follow. Advanced age, malnutrition, and coexisting disease appear to increase the risk of multiple organ dysfunction syndrome in acutely ill patients. Clinical manifestations. The clinical presentation of multiple organ dysfunction syndrome is insidious. Tissues become hyperperfused at both a microcellular and macrocellular level, eventually causing organ dysfunction that requires intervention to support organ function. In multiple organ dysfunction syndrome, the sequence of organ dysfunction varies depending on the patient's primary illness and comorbidities prior to experiencing shock. Typically, the lungs are the first organs to show signs of dysfunction. The patient experiences progressive dyspnea and respiratory failure requiring intubation and mechanical ventilation. The patient usually remains hemodynamically stable, but may require increasing amounts of intravenous fluids and vasoactive agents to support the blood pressure and cardiac output. Signs of a hypermetabolic state, characterized by hyperglycemia, elevated blood glucose level, hyperlactic acidemia, excess lactic acid in the blood, and increased blood urine estrogen, are present. The metabolic rate may be 1.5 to 2 times the basal metabolic rate. At this time, there is a severe loss of skeletal muscle mass, autocatabolism, to meet the high energy demands of the body. After approximately 7 to 10 days, signs of hepatic dysfunction, for instance, elevated bilirubin and liver function tests, and renal dysfunction, for instance, elevated creatinine and anuria, are evident. As the lack of tissue perfusion continues, the hematologic system becomes dysfunctional, with worsening immunocompromise and increasing risk of bleeding. The cardiovascular system becomes unstable and unresponsive to vasoactive agents, and the patient's neurologic response progresses to a state of unresponsiveness or coma. The goal of all shock states is to reverse the tissue hyperperfusion and hypoxia. If effective tissue perfusion is restored before organs become dysfunctional, the patient's condition stabilizes. Along the septic shock continuum, the onset of organ dysfunction is an ominous prognostic sign. The more organs that fail, the worse the outcome. Kindly click the next button for part 2. Thank you for listening. Have a good day and be safe. Agyamanag.